Mayo Clinic has a very long tradition of providing excellent care for patients with multiple sclerosis. In fact, we were very much involved in some of the very early research that was done in the disease, but we've also been leading the field in terms of practice, in terms of providing care for patients.
For referring physicians who see a patient with a new diagnosis of MS, the most important thing is going to be to get them on the right medication going forward. We can really control MS much better than we used to be able to. We have many physicians who reach out to us. We really try to partner with those physicians, particularly as many of those physicians may not have a great expertise in multiple sclerosis, and we want to help educate them, help guide the patient, and help do what's best for the patient. We see about 3,500 patients a year, and we have great expertise in ensuring that we have the correct diagnosis and we know which treatment is best for which patient. So I think coming here and getting that treatment correct at the start is very important.
Patients that come to the Mayo Clinic become part of the answer in terms of the research that's going on at the Mayo Clinic, because the Mayo Clinic has the largest biorepository of MS and autoimmune neurological disorders in the world. We now have drugs that reduce the chances of a clinical relapse by 98.5%. That's pretty amazing.
We're now learning more and more about MS that it's not just all about the attacks that patients may have with their MS, but there's things happening in the background. We know that multiple sclerosis can affect a lot of parts of the nervous system, ranging from vision to walking to bladder, stiffness, cognition. We can measure nerve damage. We can treat things like muscle stiffness or spasticity. Mayo Clinic can offer a lot for patients in new diagnosis, but also in patients with an established diagnosis, maybe with some damage, that we can ensure that we can manage all of those symptoms.
You don't just see a neurologist, you see a multitude of different individuals, all of whom have specialty experience within the care of multiple sclerosis patients.
It's the neurologist talking to the physical medicine rehab team, talking to the ophthalmologist, talking to the urologist to come up with the best plan for the patient.
We're working with physiatrists, we're working with people that work in bioelectronics to try and develop approaches that we can use to not only stopping the progression of the disease, but restoring function.
There are many patients out there who come to Mayo Clinic, and Mayo Clinic is their last hope, and we really want to make sure that we get them the answer that they need for their condition, because figuring out the right diagnosis is really the first step towards treatment and getting them on the right path going forward.